Hi, this is Lee from jawphysio.com.au. TMD or temporomandibular dysfunction and also migraines are classified as chronic pain. So when you see a therapist, you want to make sure that they assess your whole life. Under international standards, TMD is classified as a build-up of many medical conditions, stress, psychological templating, triggers, all that sort of stuff. So very, very important that it's not just the mechanics of the jaw and the neck that you're being assessed for. We also know that inflammation is a big part of this condition. So the therapist needs to have some training in awareness of diet, so they can advise you about reducing your sugar, and having a diet that best suits your lifestyle, your age, and that sort of stuff. They also need to be aware of respiratory medicine or sleep medicine. And there are 3 important questions they should be asking you to see if you are suffering from sleep apnea, or if you need to see an ENT for any blockages. They also need to know about gut conditions, and what's appropriate for your bowel motions, what time of day you're having them, what they should look like, how to educate you on being healthier. Also, they need to know different medications, and that, a change of medications for up to 3 months, coming on or coming off medication, will greatly increase your clench reflex. You also need to know about gentle exercise, and any heavy weights above shoulder height will greatly increase your migraines, neck pain and jaw pain, and have a lot of ideas about how to gently exercise, particularly type A personalities, perfectionists, who are so busy at work that they're already in burnout, and then they go to the gym all the time and they're in burnout again. So it's really learning about moderation. They also want to be assessing your work-life balance, that work should be about 40% of your life, and know what amount of hours for females and males that are appropriate per day, so that you're able to disengage. They also need to have some education in sleep hygiene. So the patterning before you go to bed, how you wind down the 1 to 2 hours beforehand, and how many hours is appropriate to be sleeping, and when to get up if you've got chronic pain at night. You also want to have some counselling and psychological training or education, because a big part of this is how your brain processes chronic pain, processes reality, and processes your chronic negative talk, self-worth, and whether you're aware of that internal dialogue that's going on all the time, and how your triggers from childhood and how you were raised, and not just your parents, but the 10 generations behind your parents that have patterned all of you in the family as to how you react as an adult, and being aware of that and learning strategies on how to be more mindful and not to delve into emotions, and how to start to detach to outcomes of people around you, and learning that other people's opinions are none of your business, and what kind of tools that help that, so that you're not constantly thinking about everyone else, and you can just do you and learn how to heal and create a joyful life with resources, which is a counselling word for hobbies. How to create inspiration and joy, and not just thinking about how to schedule your family life, and the cooking and the cleaning and the taxi driving of all the children. So as you can see, it's a considerable amount of information to change chronic pain. You're not just changing 1 or 2 things, and it's up to you as the client to determine which parts you think will really help those symptoms to reduce. And that's the great part, because only you know that. So make sure you're getting your whole health looked at, and it's not just the mechanics, it's not just your muscles. There's a lot more to it. Thank you.